So, what do you find to be the most challenging aspect of being in practice, and how do you overcome that and make it work?
So for me, I think the most challenging thing has really been right after I say I don't really need a whole lot of support. The most challenging thing has probably been wearing the multiple hats, right?
Hmm.
And I think the biggest thing is me being the president in regards to the actual business, but also being the doctor, right? I think it has been made a little bit easier now because I do have staff that to some degree acts as a little bit of a block for me in some regard. But I just know that there have been times when what should have been a business decision, it became a clinical decision, right? It's really hard for me to not provide a service or to do something for a patient when I know that it's going to actually benefit them, despite perhaps their insurance not covering it, perhaps the individual not necessarily having the financial means to afford it. Um, it's just hard for me as a person not to do that. And so it that doesn't always translate to good business sense. And I feel like that's probably my biggest struggle. And I obviously haven't figured it out yet because I'm 20 plus years in and it's still an issue. But I do feel like it has gotten better because again, I do have now staff that somewhat can act as a block and maybe the situation doesn't even get to me
Yes,
for me to have to make that decision.
that's so helpful. So helpful. I
Mhm.
mean, when they're looking at you and they're shedding a tear, and you know, their right arm's numb, and they're poor, and they're eating
Right,
spaghettios. You know what I mean? You don't. I mean,
right,
we're all hardwired to be of service to
right,
the community.
right,
It's tough. But
right,
when you put somebody at the desk and you tell them, listen, your job is to collect money, they're like, this.
right,
So
right,
that's
right.
kind of
And
nice.
that's the really awkward thing, right? About being that one person show, right? Like you had to have the financial conversation with people right after you just told them what it is that you think that they need, right? So that was hard, and that's been made easier by having the staff. But there are still times when I'm doing my report of findings, or something along those lines, and yeah, it's like, well, your insurance isn't going to do this, but let's go ahead and do it anyway, right? So
Right. It's
yeah,
what you
that,
need.
that's
So that's
challenging.
just treatment.
Yeah.
There you
Mhm.
have it. That's good.